All right, Mr. Chair, you have quorum, so the meeting is yours.
Thanks, Madam Clerk. Good afternoon. I'm Brian O'Leary. This is the Mental Health and Addiction Task Force meeting, May 17th, 2022. It's 1 p.m. We'll call the meeting to order. Is there a declaration of interest? Anyone? Seeing none, if one arises, you can declare at that time. Our first speaker today is Brenda Lawson, Public Prosecution Service of Canada. Good afternoon, Brenda. You have the floor.
Mr. Chair, Ms. Lawson notes in the chat that she is here, but she can't be heard.
Yeah, Rob just let her in, so
She's fixed. Okay, that's great.
Yeah.
Just joined.
There we go.
She is.
Perfect.
I was getting frantic and I'm really sorry. I was here and anyway,
You don't have
good
to be
afternoon,
friends with
everybody.
us. We're a great group. Just relax. Lots of time. You have the floor.
It's nice to be here. So I am one of the agents for the Public Prosecution Service of Canada. That's quite a mouthful. Public Prosecution Service of Canada is part of the federal government, and we are responsible for prosecuting drug offenses and only drug offenses. Sometimes we get carriage of criminal code matters, but typically our job is to prosecute drug offenses. And as a result of the opioid crisis and different treatments of people with substance abuse disorders, PPSC has come out with new mandates. And one of those new mandates, for example, is when we're dealing with people with substance abuse disorders on a bail hearing, for example. And on a bail hearing, typically we would say one of your conditions of release on bail is that you not be in possession of any drugs not medically prescribed to you, or that you not be in possession of any drug paraphernalia, or we may also put geographical constraints on someone. And all of those different conditions can trigger a breach. And so to avoid triggering a breach, we're under a mandate when we're dealing with people who identify as a person with a substance use disorder. We don't ask for those conditions. And we don't ask for those conditions because we don't want to bring someone into custody with an opioid addiction and have them be in jail for a relatively short period of time. They could be in jail for 7 days, up to 30 days before they resolve their matter and get back out again. Well, we all know what happens after 7 to 30 days period of abstinence. These people would get out of custody and they would go back to using their usual amount of Schedule I substance, and they're at a higher risk of overdosing. So we don't ask for those conditions in the first place so that they're not reincarcerated for short periods of time. So we do that to recognize that this is a health problem, to recognize that there are people with these issues, and to try and keep them safe by not placing conditions on them that they wouldn't be able to keep. It would be like telling an alcoholic or someone with a drinking disorder not to drink. They're just not capable of doing that. So that's one of the things that we do with respect to people with those disorders. We always ask counsel, will your client be able to comply with these conditions, or do they identify as someone with a substance use disorder? And we go with whatever the accused person says. So if they say, yes, I identify as someone with a substance use disorder, then I don't ask for those conditions. And so that's with respect to bail. Now, we do the same thing with conditions of probation or conditions for a conditional sentence order. Again, if the person identifies as someone as having a substance use disorder, we won't ask for those conditions on the basis that it's setting them up for a breach. We know they're not going to be able to comply, And we don't want to have those conditions that we know they're going to breach, that are going to put them back into jail for a short period of time and risk having them overdose when they get back out. I had an accused who had been charged with possession for the purpose of trafficking. And he was charged in February of 2021, February 2020, just right around the time of COVID. And when COVID came along, we were consenting to releases of a large number of people to get them out of the jail because of COVID. And he got out of jail March 26, 2020. And within less than 24 hours, he overdosed. Now, fortunately, he didn't die, but he went straight to his stash, got his stash, and he overdosed. And so those are the things that we recognize that are serious issues, and we really try to avoid those issues. So, I mean, it happens. So with bail conditions, with conditional sentence order conditions, we don't like to set people up with breaches that are going to put them back into custody for a short period of time. There may be other reasons that they find themselves back into custody, but they're not back into custody because of conditions that we've insisted on imposing on them. We also have the Good Samaritan Drug Overdose Act, which is under the Controlled Drugs and Substances Act. I'm sure everyone here is familiar with the Good Samaritan Drug Overdose Act. That is something that not only protects the person who may be having an overdose, but it also protects someone who may be there when someone else is having an overdose. People know that if they call in a 911 for an overdose, they know that they're not going to get in trouble if they are in simple possession of narcotics that aren't medically prescribed to them. They know that they're not going to get breached on their bail if they have a condition that says not to be in possession of drugs. They know they're not going to get breached on a condition of bail if it says no paraphernalia. Those charges are off limits to anyone either calling for 911 attention for themselves or someone else. And so it's incentive for people who are experiencing troubles. It's incentive for them to be able to call 911, knowing that they're protected and they're not going to be charged with being in possession of drugs or paraphernalia or breaching their bail. Now, if they're in possession of a lot of drugs, that would be for the possession for the purpose of trafficking. That's an entirely different ballgame. They face being charged with a possession for the purpose of trafficking. If there's other indicia of trafficking, that would be cash, cell phones, packaging, scales, quantity of drug, and or variety. You know, you might see someone with cocaine, methamphetamine, fentanyl, hydromorphone. Well, that's more than likely not just personal use. And so if they're possession for the purpose of trafficking, they will be charged with that. They will be first responders will take them to the hospital if that's necessary, and police will leave them there, and police will say to them, turn yourself in when you're out of the hospital and when you're better, because we will be arresting you. So they get their medical attention, and then they're told to call in or to report in and get that warrant executed on them. So the Good Samaritan Drug Overdose Act, as I indicated, is good incentive for them to feel safe and secure, knowing that if they're just helping someone out, they can help that person out without the jeopardy of being charged themselves. If they're breaching something else, say they're on house arrest bail, and they're supposed to be at mom's house and they're at boyfriend's house, they can be charged with breaching that particular condition. or if there's warrants out for their arrest already. Obviously, the police would have to arrest them on any outstanding warrant. But if it's just drugs and just for the purpose of helping someone who's overdosing, then they have no risk of being charged. And so that's a good incentive. And then recently, so August of 2020, the federal government came out with a new guideline with respect to simple possession of narcotics. We call them 4-1s because that's the section under the Controlled Drugs and Substances Act that charges simple possession. And the federal government decided that substance abuse disorders is a health factor, and rather than criminalizing the behavior and saddling people with criminal records, that even though the police may still charge the offense, in 9 out of 10 cases, federal crowns don't proceed to prosecute. So if you're charged with a simple possession of a narcotic, you're given a first appearance date. Typically and hopefully, on that first appearance date, I will have received a brief of the allegations. And once I read it and satisfy myself that none of the preconditions exist for me to go ahead and prosecute, then on that first appearance, I will withdraw. So that person who has maybe been charged with simple possession, doesn't matter what the substance is, I withdraw everything in the CDSA. It doesn't matter if it's fentanyl. I get a lot of counsel saying, well, it's fentanyl. Are you still going to withdraw it? Yes, we do. We do not proceed on most of the simple possession narcotics charges anymore, and we haven't since August of 2020. Now, lots of times people will get arrested. They'll have an outstanding warrant for whatever, and when they're arrested, the police will search them incident to that arrest for evidence of that charge. They're often in possession of the drugs. Notwithstanding the other arrest, I will still withdraw the simple possession of narcotics, and that's across Canada. The only time we proceed with a simple possession of a narcotic is if there's what we refer to as a serious manifestation of the charge. So let me give you an example of that. I got a call from a police officer one day who said, we had this fellow who was wanted for some break-ins, and we saw him in town. And as soon as we clocked him, he started to run away from us, and we had a foot pursuit. So they're chasing this guy through town. It's a small town. They're chasing him through town, and as he's running through town, he's throwing stuff away from him. And a passerby picked up what he was throwing away and handed it to the police officer and said, this guy just threw this onto the sidewalk. Well, it happened to be over a gram of fentanyl in 2 different packages. Now, that is something that we're proceeding on because it's a serious manifestation. He put the public at risk of harm. He put the police officers at risk of harm because he was getting rid of the drugs on a busy street in a small town, 4:30 in the afternoon. And so that is one instance where we will proceed on a simple possession where they're putting the public at risk. And those types of charges don't happen very often where we do proceed with them. And in that particular instance, the fellow had other charges, and the sentence that we are asking for runs concurrently with the other charges. So we're not asking for more time. We're just saying, We want to see the conviction on his record. But we're not going to ask for more time in addition to the charges that he was arrested for. And so that's a pretty good overview of the newest directive that we have with respect to simple possessions. I would say police are still laying the charge. They leave it up to us to decide whether or not to prosecute it. But as I indicated at the outset, I would say 9 times out of 10, we don't proceed and the charges are withdrawn. And sometimes it's a hefty quantity. But if it's simple possession, then we're mandated to not proceed. And so all of those are different practices that we have with respect to drug prosecutions that take into account persons with substance abuse disorder. The other point was, I believe, with respect to young offenders, that's on the that's a topic of interest as well, correct? Where's Tara? Yeah, okay. I don't deal with a lot of young offenders, but if they're charged with drug offenses, I certainly do. And I can tell you that with young offenders, the first of all, their bail, it's my onus to keep them in, which is it's a higher threshold. So if 10 times, 9.5 times out of 10, a young person will get released from the station. 9.5 times out of 10, if they are held for bail, they will get released on consent. It's not the typical case where a young offender is held for bail or detained. In all of the years I've been doing this, I can think of one young offender who was detained after a bail hearing, and he had a hefty criminal record for someone who was 17. And he had charges outstanding in other jurisdictions. He had a possession for the purpose of trafficking outstanding in another jurisdiction. And in the jurisdiction in Walkerton, he had possession for the purpose of trafficking in fentanyl. He had 1.5 ounces of fentanyl on his person, and he had a loaded gun. He was detained. And he spent some time in pre-sentence custody. But, by the time he resolved his case, he was in a time served situation. So, he would have spent 7 months in jail. That's a really, really long time for a young person to be in jail. But with his criminal record, he had done time in jail before. And he, as I said, he had charges in other jurisdictions. Very typically, young offenders will start off with a discharge of some type. Could be conditional, it could be absolute, so it could have terms attached to it. They will often get community service. Certainly if I had a young person charged with, let's say, a large quantity of marijuana, and it's for the purpose of distribution, I might ask for community service. I might say, I want to see you do 50 hours over and above what you have to do for school of community service, and then I'll withdraw the charge. If they've got a record with prior related offenses, I might say probation, or I might say a fine. But rarely do I ask for jail, and rarely do they get jail. The one instance was the one I talked about. And, over the last 5 years, that's the one and only one where a young person got a significant sentence. Typically, they are dealt with far more leniently and until they hit 18. Once they hit 18, all bets are off. But certainly as a young person, they certainly have all of the advantages of the system trying to help them get reintegrated deal with any issues that they may have. And often those issues, you know, are either substance related or, you know, family issues and whatnot. So I think that's all the information I can impart on the group today with respect to my job and how we handle persons with substance abuse disorder. I hope it's been helpful. If anybody has any questions, feel free to ask.
Thank you, Brenda. I do have a question before I go to the rest of the committee. And I'm not sure the answer to this, but regardless, I still want you to speak on it. How often does a judge give an addict the choice of, say, 18 months in jail or 6 months in a treatment center, say in Guelph?
That doesn't happen that often where a judge will do that. By the time we get to dealing with a matter in front of a judge, we have had many discussions, defense counsel and myself, and or we'll have a judicial pretrial, which is a meeting with a judge and defense counsel and myself. And it's a very candid meeting. It's just the three of us. We talk openly about the issues. And in a meeting like that, defense counsel could say, my client has a serious substance use disorder, and she would really like the opportunity to go into treatment. And my response is usually, great, have your client go into treatment. You know, let's see a residential treatment and let's see what happens. Let's get a report after she gets out, give her some time, see how she's doing, and then maybe we can consider a conditional sentence order, which means she doesn't go to real jail. So again, it puts the incentive on the individual to actually take the steps to get into treatment and do that.
So it's not something you can force on them. You
No.
can't. Well, but what if it's a choice? Like you're either going to jail for, say, 18 months or you're going to a treatment center. Which would you prefer?
Most people would take the treatment center, but that's something that usually comes up before sentencing.
Okay.
It would be something we've discussed before a guilty plea is entered and before sentencing.
I mean, I don't know anything about this, but I'm really surprised that doesn't happen more often, and we don't have some kind of a track record whether or not it works. I just know of one story where it did work, and the person came out of the treatment center and he's still sober today.
Yeah,
so
there are those stories. Yeah,
right.
there are those stories, and they're great. And in some of those cases, I had one myself, and where the person went through treatment and did very well. And as a result of that, the incentive, or the carrot, as I put it, the carrot was, you know, you go through residential treatment and come out and get me a good report and do your follow-up, and you know, I'm not going to ask for jail. And you know, that's exactly what happened, and it's happened with a number of different people. Unfortunately, sometimes we'll see that incentive given, and then they will reoffend before they've had an opportunity to take advantage of it. And you know, I've had people, okay, you know, I know that you're waiting to get into treatment. I'll agree to your bail, get into your treatment program. Like, you know, I think that the Crowns who work in this jurisdiction are pretty reasonable. And I think that, you know, where people show an incentive or a desire to do something about their issues, we will do what we can to facilitate that. You know, it's not easy to get into treatment. And so if someone is out there and wants treatment and they take the steps to get in and they're accepted, that's a pretty strong desire. And that's evidence of a pretty strong desire, you know. Right. And it's not their mom who's filling out the application and doing this, or their, you know, their family members or their wives. They're going out, they're doing it themselves. They're doing the assessment. You know, they're making the steps. You do that, and chances are pretty good that we're not going to seek jail.
All right, thanks for that. Any other questions for Brenda? Madam Clerk, you may have to help me out here. Okay,
Just
Kim, go ahead.
one other example. I had a fellow who had done all of that. He pled guilty. He got a conditional sentence. He had an ounce and a half of meth, and he got a conditional sentence. While he was on that conditional sentence, he'd been on it 6 months. He was arrested and charged with possession for the purpose of trafficking in fentanyl, and he had half an ounce, and he had 2 ounces of methamphetamine, and he had a whack of marijuana, and he had all sorts of text messages on his cell phone that showed that during the period of time he was on his house arrest conditional sentence, he was selling drugs. So, you know, you see both sides.
Right.
So,
Thank you.
sorry, Kim, you wanted to ask a
Kim, go
question?
ahead.
2 questions, if I may. First, thank you so much. This has been very enlightening. I certainly didn't have a very in-depth understanding of any of this, and so you've helped a lot, Brenda. Thank you.
My pleasure.
One question was about that access to treatment. And if I'm hearing correctly, what you're saying is even though someone is justice involved, there is no fast path to treatment. If people say, I would go to treatment, they're in the same queue as anybody else that might want to go to treatment. You don't get to have the first right of spaces.
Yeah, and it's a problem. You know, it's a huge problem. I have a bit of a different perspective. My husband does criminal defense work. So I see what he does to help his clients, and I do the prosecution. And I know, well, and I hear this from people that I work with on in prosecution of cases. If someone's in jail, for example, it's really, really hard to get into treatment
Right,
from jail.
right.
If people have charges outstanding, it's really hard for people to get in for treatment because they're not supposed to be having access to the outside world. They're not supposed to have these things hanging over their head.
Mhm.
And it's difficult for them to get into treatment. There are some treatment centers that will take people from jail, but not many. And there are some that will take people with charges outstanding as long as their counsel say, we'll take care of their court appearances. They don't need to worry about it. They don't need to stress about their court appearances. And so some treatment centers will. In cases like that, you know, I will often agree, okay, well, we'll adjourn it, you know, longer than we normally would
Mhm.
because your client's in treatment. I've had people in treatment for, you know, 8 months, and we continue to adjourn. We continue to get updates that they've finished the residential portion and they're now doing aftercare. So those types of situations do present themselves, just not very often.
Thank you.
You're welcome.
Thank you, Councillor Mackey.
Thanks, Mr. Chair. And Brenda, thanks very much for your overview. Can you just comment on the people that are out there making these toxic drugs that are killing people, with carfentanil and fentanyl? Are the sentences appropriate for those people that are killing thousands of Canadians every year?
Well, the sentences are very stiff for people who are certainly in possession for the purpose of trafficking or trafficking. They're certainly very stiff. You know, even for people without a criminal record, if they're in possession for the purpose of trafficking in fentanyl or trafficking in fentanyl, they're looking at a penitentiary sentence. The individual that I told you that was on a conditional sentence at the time that he was charged with being in possession of 2 ounces of meth and half an ounce of fentanyl. My position on him, if he's convicted, is 7 years in the penitentiary. And he's only got 1 prior conviction. So that's a hefty sentence for someone who's in possession for the purpose of trafficking.
Yeah, thank you.
Welcome.
Any other questions? Seeing none. Okay, well, thank you very much, Brenda. That was educational. That was super. Appreciate it.
It was
Thank
my
you.
pleasure. I'm glad to be able to make it, and I'm sorry, but I have to leave. I am still in court.
Great. Thanks so much.
Okay, take care.
Okay, moving on. Item number 4, community or YMCA employment services. Matt Shute. Good afternoon, Matt. You have the floor.
Good afternoon. Thanks for having me today. As mentioned, my name is Matthew Shute. I'm the Director of Community Initiatives and Employment Services with the YMCA. I'm going to do my best here to share my screen because I did change up some of the slides given the presentation. So just let me know that you can see a PowerPoint screen.
Yep, that's good.
Okay. The purpose for today's presentation, because there are many programs with YMCA community initiatives and employment, is really to focus on the housing and shelter related programs. So we do have, actually employment is our largest program area. And in addition to all of the employment programs, we also will have settlement and language services, diversionary youth and adult justice programs, and our youth and transition programs. I think it is important for individuals to know the range and scope that the YMCA offers, only in that a lot of these programs can act and have acted as bridges out of some of the cycles that we're probably going to discuss today related to homelessness and poverty. And my apologies if some of this is old news to the majority of you, but I did want to start off by mentioning the fact that that homelessness does happen because incomes don't match housing costs. There's an inadequate personal income with skyrocketing rents, which isn't new to anybody. This lack of affordable housing in communities pushes more people into homelessness and also makes it more difficult for individuals to exit homelessness. So it is important to remember that homelessness is a result of structural factors like bricks and mortar, systemic factors like poverty and wage, and then individual circumstance and equity of access to services. All of that is, I mean, we can see that playing out across Grey and Bruce, and that's in spite of both municipalities time and time again heavily showing their investment, not just into housing, but the people that it's directly impacting. Related to the temporary shelter program that I'll be talking about in more detail today. Temporary shelter is a process of getting people housed. The program does need to be equipped and resourced to help people get housed as soon as possible, because the longer time people spend in a temporary shelter situation, the poorer the outcomes are for that individual and the communities that they live in. Everything within temporary shelter programs like the YMCA's needs to be housing focused and solution focused, so that shelter, and you'll see this on multiple slides today, temporary shelter in and of itself doesn't become the destination. Temporary shelter is a process toward housing that is of a more permanent nature. So we will quickly cover today purpose, process, current temporary shelter need, and then temporary shelter within the broader system of human services and supports. So it's incredibly beneficial to have access to temporary shelter. There is benefits in the short term. People obviously are able to escape dangerous situations. Shelters need to be fair and equitable and acting as a bridge to more resources and more permanence. But in short, this temporary shelter program within Grey Bruce, temporary shelter programs in general, really need to be exactly that, just temporary. The longer we rely on them as solutions to a lack of housing or solutions to tenuous coping for individuals for a myriad of reasons, then we don't see the benefits of temporary emergency shelter. So the past process related to shelter access here in Grey Bruce was a bit more linear than we would experience it now. So somebody's at risk of homelessness, they called into the YMCA, they were provided with access to a worker, there was resource matching, and this is at a time when the market in and of itself and other resources were either A, much more plentiful, or B, there was less of a demand for the existing services. So that resource matching would happen, somebody would be able to access longer term housing with associated supports, and we would move on to the next individual. Again, just for clarity's sake, that is the past presentation of the challenge that we're speaking about today. That type of program worked really well for about 80% of people who find themselves experiencing homelessness. And of that 80%, we're looking at people who are probably only going to be homeless once in their lifetimes. They do have other external resources that they can tap into and utilize. And when matched with that resource and short-term supports, the homelessness system or the social service system probably will never see those individuals ever again. The challenge with services being set up for individuals in that kind of scenario is that there are another 20% individuals who are episodically homeless. So cycling into and out of and back into homelessness situations. And another 10% who are experiencing chronic homelessness, 6 months to a year, some much longer than that. And if I did insert in the slide that, or if we could just take a quick pause for a moment, homeless for over a year. So if I think about the longest trip I've gone on for work, and I'm home after 10 days, it's exhausting. If I multiplied that and thought 365 days without knowing where I'm going to lay my head at night, moving through healthy relationships and unhealthy relationships and back again, living in an extreme degree of poverty that is easy for me to talk about, but something clearly I've never experienced and is difficult to imagine. The compounding challenges that time spent homeless would present, I think, is something that all community members and all service providers need to continually remind themselves of, just how difficult sustaining and maintaining within that lifestyle would be. So I guess at this point in the presentation, a quick reminder about the resilience of individuals that we see who have been homeless for a long time, because it is easy to go down the track of all of the things that aren't going well. These are some of the most resilient people you'd ever have the benefit of meeting. So what does a day with the YMCA shelter staff look like? Pre-pandemic, it did look like arranging temporary shelter stays, following up after an initial stay, assisting clients to develop longer-term housing options and goals, connecting with other specialized services. That was the majority of the day. And I think it's important to hone in on that slide that there's one bullet point for arranging temporary shelter stay, and we'll get on to that, that challenge in a moment. Because, and it maintains, the goal of the shelter staff continues to be to minimize the time spent in shelter settings. When somebody does come through the door here with the YMCA, it's the job of the staff to understand the context of somebody's situation and their experience with oppression and trauma. They need to support the client's decision-making, even if it's not something that they would necessarily agree with. Setting realistic and collaborative goals with the client around expectation and boundaries, initiating service planning, understanding how someone's experience with homelessness is not how they are going to experience housing. And that's really critical so that we're not making prejudgments when somebody comes in the door and needs a place to live, especially if reviewing housing as a human right. Remembering that the past does not predict the future. So, like the work done by all of the different outreach teams and teams and the mobile team, it is complex, layer-ridden work that takes an incredible amount of engagement and time. The challenge in doing that type of work really, really well is that if we see a huge balloon in terms of need and our numbers of support staff have not increased to keep pace with that increase in need, providing services does become more strained. So if we take a look at the number of nights of shelter provided per month, in 2019, we have 214. Subsequently, we jump up to 543, then just under 700 nights of shelter per month for 2021. And then even as we are, I guess some would say, potentially exiting a more acute phase of this pandemic, we're now seeing just under 975 nights of shelter per month. Now that's not 975 people. That is 975 nights of shelter per month. So if I'm sheltered for 20 months, then I'm going to account for 20 of those numbers. I think so. During 2020 and 2021, it was a simple explanation to say, well, a lot of this is sort of pandemic driven. But I think the shared consensus now is that what the pandemic did was shed light on current gaps and extreme challenges, not only within our services, but across our society in general, and really shine a light on them and bring them to the forefront. And so that's what we're seeing. And I don't anticipate that number 968, even though it's only based on 4 months. I don't anticipate in seeing that decrease a lot over the upcoming months. So we're seeing that increased number along with increased complexity. So again, the longer people are experiencing homelessness, the more complex their situations are, and the higher their support needs are when they're entering into temporary shelter support to begin with. And so contributing to this increased complexity are things like increasing number of people living with significant comorbidities. So mental health, addiction, physical health challenges, a drastic inequitable ability to access resources, fluctuating access to emergency shelter services. So our shelter services right now are within motels, and that is completely dependent on the seasonal variation of the operation of those motels. Increased wait times for longer term complementary or specialized services, long lengths of stay, the average length of episodic homelessness is not decreasing. And there are a significant amount of people that aren't receiving the type of assistance required. So in that previous slide where I talked about, very briefly, all of the work and time and engagement that would need to be done to start to unpack some of the things that an individual is going to need to work through. When we see the numbers increase the way that we've seen, having that time correspond with those increased numbers, that doesn't really correlate. So it's not a critique of services, it's just a realistic portrait of where we're operating at present. So we've talked about current state, and I think actually I did have written on several slides, just in my rough notes here, to remind everybody as I'm going through this presentation that homelessness is an incredibly complex issue, but it is really important for our community leaders and system and support providers to constantly be messaging and probably reminding themselves that homelessness is also a complex issue that can be solved, and has been solved in other areas. So some of the stats today don't feel, overly laden with hope, but it is important to remember that as we go through the presentation today. Oops. So when we're looking for possible opportunities for service improvements, if we take a look at when someone's looking for shelter initially, right around this period of time, there's been some shelter or initial engagement. Now that we're up to 968 nights of shelter per month, that's where the YMCA staff are spending the majority of their time. If they're spending the majority of their time there, it is more difficult to get out and connect to those individuals who are not self-coordinating to the point of being able to make it to an appointment, or individuals who have gone through our system of support, are being partners, and have been offered one of those housing units with Bruce County or Grey County, or supportive housing through the by names list. But now the goal and the work with that individual is to help them retain the housing. So a key area of pressure, need, and opportunity, in my personal opinion, revolves around the unconnected and unengaged and our outreach to those populations. And I think that really speaks to the mobile crisis team that is currently operating, but also to the potential challenges of that team, in that I think it's 4 people, 4 very dedicated individuals who work longer days than normal, but it's only 4 people, and the need is tremendous. If I was somebody who was homeless moving through this system, when I finally get that call from the by names list coordinator out of Grey County, and I've got that unit to move to, do I ever want the supports to help me stay in that unit? If those supports aren't there, I may end up back in that cycle that we've spoken about previously today. So this isn't an ask of, a greater ask of the municipalities, because again, they couldn't be more involved than they are. I think these are areas of opportunity for us as a system to ask different areas of government and different funders, because we've highlighted these as key areas for improvement for a homeless service system. So in our refocusing of our work with people, really wanting to focus on diversion, progressive outreach, and support in transition. Diversion, which you may have heard of lately, is not a refusal of service. Diversion is the service. So the best example is someone phoning into the Y, and instead of setting up shelter right away, there's a critical conversation around where can we get you that is safe, but not in shelter. So shelter shouldn't be that initial ask or request. We do need that thorough conversation to try to steer people away from the shelter system if possible, especially when we're looking at increased numbers of individuals in contrast to a decreased number of spaces available. Diversion also must mean a safe option has been identified. So it's not a safe diversionary practice just to steer someone away if we're steering them back into a dangerous situation. So some of the shifting would be a call for shelter doesn't mean that there is no other option. Belief in a strength-based approach. Shifting from the idea that the shelter is the household's only resource. Moving to strength-based assessment. And assisting and connecting to community resources to avoid shelter. And when I say community resources, I mean all community resources. So both formal partners, but also informal supports that people clearly identify within their own lives. And this is work that is, again, it's not new to anybody, but this isn't always work that we hold first and foremost. And it's not necessarily work that we as a system are all doing together. And I think there is a danger in, without any intention, siloing off our work into different compartments does make it more difficult for the individual experiencing homelessness to move through a system and get the supports and responses that they need. It also makes it more difficult for all of our staff working in those systems to get the responses that they need for the people that they're supporting. So then we're looking at scenarios whereby stressful work is compounded over time. And then we're dealing with things like staff retention and keeping the right people in the right places. So if we're all working as diversion specialists, we'd all be solution focused, maintaining confidentiality with a real clear understanding of the process between teams and between social service providers and other community groups, really embracing self-determination and honesty with the individuals that we're working to support on a day-to-day basis. The outreach would be progressive in that we would be going to find people who needed the support, offering the support that is required, case conferencing around that 4-day mark so that people aren't left in a temporary shelter situation only to exit back into the same situation, and really being flexible around accessing more intensive services when needed. And when we're not able to access those intensive services as when we'd like, as needed, coming together as a system and advocating for more resources as required. So as I mentioned, skilled outreach, low barrier, housing focused, maximize rapid rehousing whenever we can, and coordination between support services, shelter services, reminding all of ourselves that we're all working with the same individuals within our communities with the same outcomes in mind. And then ensuring that we're asking both our partners and ourselves critical questions so that we can answer that pivotal question of how do we know what we're doing is actually working? So are we optimizing our current capacity? Are we accommodating the needs of people who are living unsheltered? How can we prevent or rapidly divert people from experiencing homelessness in the first place? In what way can we provide housing first, not housing only, to support people as they move in? In what ways can we increase the amount, the sheer quantity of housing? Are we operating short-term shelter programs with a housing exit plan? And I have written here in mind, we need to be operating short-term shelter programs with a housing exit plan in hand instead of in mind, so that the person leaving short-term shelter has a clear idea of what their goals are and who they're working with and who their contacts are. And are we all viewing homelessness through the same lens as a complex problem and something that can be solved? And that's it for the slides today. Thank you very much for your attention.
Thank you, Matt. If I could just get you to stop sharing your screen. Any questions for Matt this afternoon? Councillor Keaveney, go ahead.
Thank you very much, Chair O'Leary, and thank you, Matt, for a very informative presentation. It's certainly concerning the number of additional nights that are required through your program at the Y, and I'm wondering two things. First of all, as that number continues to grow, do you have access to enough temporary beds for people? And are there beds in each of the lower tiers, or do people have to be transported to Owen Sound?
The majority of space that we have available to us, again, fluctuates given how full a motel owner is. The challenge with that increasing number, sitting on an average of 968 now, is that I've never been part of any program where resources are unlimited. And so I don't think resources are unlimited for the shelter response system either. And that's why I think a critical move is to move toward a systemic and collaborative approach toward diversion versus shelter first, because there aren't funds available now like they were available during the pandemic. A lot of those funds across housing and shelter programs, employment programs,
We're losing Matt.
I think he froze.
Send him a message and see if he can log back in again. I think we've lost him.
Yeah.
You there, Matt?
yeah, I hope nobody thought I just hung up.
No, we waited for you. Okay, any other questions?
Yeah.
Did he get to finish?
Oh, did you finish, Matt?
I did, yeah. I just thought everybody was struck with what I said. Yeah, I wanted to finish with just the fact that it's an everybody in approach related to diversion. It takes creativity and constant revisiting of established practices and process to meet this kind of dramatic need. And I guess to the earlier question, if the YMCA purchased a shelter or a hotel, motel, which the YMCA would never do, but if we did, and it had 40 units in it, we would fill the 40 units within the first month. And then next month, we would fill the following 40 units, and so on and so forth. And so a different approach to this, I think, is required, and I'm sure the municipalities can speak more directly to that.
Okay, Shirley?
Thank you, Chair O'Leary. May I follow up with another question?
Absolutely, go ahead.
Thank you. I appreciate that. Oh my goodness, and now do I remember what it was? Yes, I'm sorry, I apologize. I'm wondering if I could ask Matt, do you find that the people are predominantly local who are in need, or people coming into our counties because there's a more available access to temporary housing? Is just such a dramatic increase. I'm wondering if it is COVID related, or is it a combination of factors, or are people coming into our area looking for shelter?
Say the increase in numbers isn't related to sort of a mass influx of people without homes coming into the area. That being said, what we're experiencing in Grey Bruce is we could draw that out over an urban center like Toronto, or another rural and remote area like Northwestern Ontario. The numbers everywhere are increasing. And I think it's certainly a combination of the skyrocketing rent costs that I talked about, without personal finances increasing whatsoever. The actual availability in terms of number of units available per renter. The vacancy is ridiculously low in our area. And if I were in seek of shelter or housing, and I knew I definitely couldn't afford it in Toronto, so I hitched a ride to Guelph, and it was still really unaffordable. And somebody mentioned that maybe it's a bit cheaper, like in Owen Sound. I'd definitely be looking. And so we do see people from out of area. It is a fairly consistent message, though, around if you've got housing and related supports in an area that you're already living, don't come here and expect the same thing, because it'll take a lot of time to set those up. And especially in relation to the housing, that can't be guaranteed. You could spend a fair amount of time without shelter. And that message, in a very compassionate way, is certainly delivered to folks. But yeah, a combination of factors.
Great, thank you. Councillor Mackey.
Thanks, Mr. Chair. And Matt, thank you very much to you and your staff for all the hard work you're doing for the people that need shelter. I'm just wondering, and Josh can maybe help out in this, I think the last time Anne Marie spoke to County Council, the wait time to get into Grey County housing was about 2 years for a single individual. I'm not sure if that's changed, but I suspect it's probably about the same length of time. So from the emergency shelter situation, and knowing, as you referenced, what the rents are at, how does a person, what happens in the interim between that emergency shelter and getting into a county subsidized housing program? Where's that person going?
So that's the tie-in to other supports. And so if they came into shelter because they had slept outside, but through that initial conversation that you have with them, they've got a cousin in Collingwood, a sister in Southampton, trying to connect people to natural supports while they wait for that subsidized unit with Bruce County, Gray County, supportive housing, setting people up with jobs in the meantime so that their own situations are improving. Scott, it's a fairly individual response to that question because everybody presents with distinct needs.
Yeah, I guess, Matt, I'm thinking about the most disadvantaged people that maybe don't have all those opportunities. I'm just wondering, what happens with those people?
It would depend on the way in which they were disadvantaged. It's a key piece of all system service providers at this point to make that referral to the by names list, to ensure that individuals living with the greatest degree of vulnerability and experiencing chronic homelessness are on that by names list. They're prioritized on that list, and then they are offered housing as soon as possible after community planning and available supports. So that's the current process. And I guess to that end, because this is intended to paint a picture reflective of the current need, but I think it's important, and I'm sure the group has either already heard from the by names list coordinator or will be. I think we're looking at over 40 people having either been directly or indirectly housed through that process in a fairly short time period. Like I would say 40 people just over the last year. And I haven't seen Josh respond with, "Oh my gosh, what are you saying, Matt?" So I'm going to say it's accurate. But that is a process that has led other communities to see a great reduction in their homelessness population. And it's also something that's in place, and people haven't sort of stepped back and taken a look at the by names list and thought, this is working great. No more requirements or adjustments needed. It's a constant quality improvement process where everybody's thoroughly invested. But 40 people in a year is a lot of people. Maybe Josh, you can more aptly speak to that.
Yeah, if it's okay with you, Chair O'Leary, I'll jump in there.
Sure, go ahead, Josh.
And thanks, Councillor Mackey. That's a great question. I think really what we're seeing is an increased need. I know you had mentioned the waiting time of around 2 years. Unfortunately, it would be higher. I mean, I think it's important that we're pretty blunt about those things and open and honest. And the wait time for somebody looking for rent geared to income housing is more than 2 years now. It's going to vary greatly depending on what area of the county you're looking for, what bedroom size you're looking for. We're also seeing a much higher increased demand related to victims of domestic violence and human trafficking, who have a provincial priority around the waiting list. So if an individual is applying and is not in one of those categories, it could extend the waiting time for a county unit. So typically we'd be closer to 3 to 4 years on the low end, depending on the unit size that they're looking for. In response to Matt talking about the by names list, you will be hearing from the coordinator and myself next month in early June at one of your next meetings, maybe the next meeting. And it really is all around coordination of services. And we call it a coordinated access system because it's about identifying individuals to add them to the by name list, identifying the correct supports that are relevant to them, and trying to engage with getting dedicated resources to those individuals. Because right now what we have is a bit of a siloed way of rolling out services. So this is all about trying to bring that together and prioritize people based on the services and supports that they need. So very individualized. And from the county's perspective, one thing that we're really focused on in housing this year is rolling out some of our rent supplement dollars that came from the province through the portable housing benefit to support people that are on the by names list who are lower acuity that could likely maintain their own accommodations with a lower level of support, and just providing them with that extra financial piece that they need.
Thank you.
Okay, Scott,
Thank you.
any other questions? Kim, go ahead.
Can I just ask whether it's Matt or Josh, one of you? I think it's important for this committee to hear about the incidents of people living rough and sleeping outside at the minute.
I don't have exact figures to communicate to the group. I stopped on the way into work and bought a coffee for somebody sleeping on a really tiny hard bench. They'd clearly been there all night. The number of encampments has certainly increased. And the challenge also with that is that the number of encampments has increased, but they are further from the center of town, making some of the setups of the encampments more dangerous for people who are seeking shelter there. So yeah, I don't have an actual number to provide the group, but Josh, maybe you've got that.
I also unfortunately don't have a number in front of me to provide to the group, but I can just say increased number of individuals sleeping rough, increased number of individuals choosing to be unsheltered that have been offered services. And we're actively trying to connect with them to build rapport and to connect them with supports. And I know when Caitlin Curry, our homelessness response coordinator, and I come back next month, there'll be a lot of talk about the inflow and the outflow for the by name list and around individuals that are experiencing homelessness and sleeping rough, and trying to talk about what our plans are prior to the seasons changing into next winter.
Just one follow-up. It might be, it just comes to mind now that as the prevalence of this increases, it might be valuable to communicate to our member municipalities and their bylaw enforcement, people who may run into these situations and not be as familiar with who they might call or how best to handle that situation.
Definitely. Talking about diversion like Matt talked about, and making sure that the approach is consistent and really that we're empathetic as opposed to sympathetic, and trying to support people and understand where they're at and not criminalizing it. I know our first speaker spoke a lot around criminalization and stigmatization. So just making sure that we're all trying to provide the best supportive approach to homelessness.
Thanks.
Mr. Chair, I did see Dr. Zayed's hand up.
Yeah, go ahead, Dr. Zayed.
I want to thank you, Matt, for this great presentation. And I just want to highlight the most important things, like with relation to drug addiction and opioid crisis, and how these social determinants of health are really greatly linked to that crisis. And there are, it is one of the most important things that make people turn a corner in their in this journey of addiction is really to have permanent housing. The other, it's one of the most important, like by evidence. The other thing that we are also having some strategic focus in public health about some other related housing issues that are really complex, which is a home takeover and the human trafficking. Both issues have been also identified and has been in increase, and that will they are either outcome of the drug addiction or can contribute to the drug addiction. So these are also socially complex issue related to housing that I just want to highlight, and our social determinants of health nurses are taking these two files and working with partners in the community.
Great points. Thank you, Dr. Zayed. Okay, I don't see any other comments. Oh, Councillor Mackey, go ahead.
Thanks, Mr. Chair. Matt, the emergency shelter services, are they available, or how does someone connect, after 9 to 5? someone at 8 o'clock at night needs a spot. Is there a phone line? Is there a person working in the evening to coordinate that access to an emergency shelter?
At the present time, from about, I guess from 5 o'clock until 10:30, people phone a volunteer line through Safe and Sound. And after 10:30, it's 211 for a general listing of resources, or police assist with that. But what we're moving to with the, well, when I say we, the homelessness response system is moving to having 211, a dedicated 211 team, field all of those calls as they currently do in Simcoe. So it'll be a response across Simcoe, Grey and Bruce for access to emergency shelter outside of business hours, all through the night and weekends included.
Thank you.
So that should be in fairly short order. We're looking to just finalize some of the processes required for that. And again, that's something that's, in essence, it's hosted by the YMCA, but it's fully funded by our municipal partners.
Great,
Mr.
thanks.
Chair, I did see Councillor Carlton's hand.
Okay, we're going to go to Councillor Carlton, but just before we do, I have to get to another appointment right away. Scott, are you able to just take over as to chair the rest of this meeting?
Yeah, no problem, Brian.
Okay, great. Thanks so much. We'll go to Councillor Carlton. Go ahead. Thanks, everyone.
Thank you, Mr. Chair. I just had a question back to the living rough. And are there, because I understand some of these people who are living rough have chosen that. They don't want to be in a shelter anywhere. So are there things done to ensure that they at least have a proper tent, sleeping bag, that type of thing, so that they're not literally in the rough, or how is that handled?
Yeah, so that's someone making that decision will get, I mean, the decision's not sort of made in a state of inertia, so progressive outreach will continue to go out and see individuals in situations like that. And I know that that is a large part of what the SOS mobile team does at Current in terms of their outreach to people living rough. So yeah, somebody may make that decision on a Tuesday, but ideally they'll be seen again the following day and offered whatever basic human needs the following day again.
Any other questions from members of the committee? Heather, are you seeing any? I'm not.
No, sir, I'm not.
All right. Well, Matt, thanks very much. It was very informative and certainly continue the good work. And I look forward to that 24-hour service being available for people that find themselves in need at inopportune times. So thanks again.
All right. Have a great day. Take care.
All right.
Bye.
Is there any other business? Again, I am not seeing any. We have two scheduled meeting dates, one for June the 7th and one for June the 21st. I hope those are available for everyone. And if there is nothing else, I will take a mover to adjourn.
I see Councillor Burley and Councillor Clumpus.
Okay, thank you. I didn't have them on my screen. All in favor of adjourning? That is carried. Thanks, everyone. Have a good day. Enjoy the rest of your afternoon.